Good afternoon. I'd like to call the Health and Human Services and Aging Committee Wednesday, July 12th, 2023, and a few minutes after 1 o'clock. Madam Clerk, if we can have a roll call, please.
Yes, good afternoon, everyone. It is now 1:07 p.m. As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Ms. Stevens. Ms. Stevens is absent at the moment. Ms. Turner.
Present.
Mr. Miller.
Present.
You have a quorum.
All right. Anyone signed in for public comment?
Yes, Lou.
Hi, good afternoon. Well, not too long ago, I was here talking about the air qualities. Today, now we probably have to talk about the water, the rain, the leaking, the flooding, those type of things. Sure, we know county jail has structural issues, same as the homeless shelters. It doesn't matter if it's 2100 Lakeside Avenue or 2227 Payne Avenue. I have been here proposing a better solution is to demolish these two main buildings while they are trying to renovate the newer buildings. Yes, it may look like a costly project, but comparing to a new county jails, this can consider as the investment as old as county jail or even others have never been fertilized in any way to ensure the county service can be properly provided to help the people in need. People in county jail, even they are inmates, we know most of them are not actually even get convicted for anything yet. People in homeless shelters are the people already got excluded by different systems in the society due to the wrong, outdated public policies, not fitting the current 21st century, or let's just even say 20th century to start. So should we get to these investment as soon as possible, or we are still looking at some of the things attracting outside people to spend the money in our area, and we consider that's the way to vitalize local economy? Please, consider the real solution for our issues. Our economy can actually vitalize by our own people. Taking care of the family, being a good workforce as a start. This is a more sustainable way to do it instead of depending on making some fancy buildings or fancy sports team locations as the tourist attraction only. Because those only vitalize business areas, maybe only downtown, maybe only certain areas. Not the whole city of Cleveland, not the whole city of Garfield Heights, not the whole Cuyahoga County. Here you are guarding everything for the county. So please, don't be as nearsighted as those developers. You can be farsighted because you are elected by the people. You should consider all the people, not just a certain business interest group, not just some of the people only think about themselves. You are here to serve because you believe in public service. So please invest for most of the people, even it cannot be all the people. Thank you.
That concludes the public comment portion for today's meeting.
All right, thank you, Madam Clerk. We had our last meeting on June 28th. If I could have a motion to approve the minutes.
So moved. Second.
Moved by Turner, seconded by Miller. All in favor, please say aye.
Aye.
All right, there are several items that are referred to the committee this morning.
And Madam Chair?
Yes.
I would just like the record to reflect that Ms. Simon is in attendance as well.
All right, welcome, Councilwoman. There are several matters referred to the committee today. Madam Clerk, if you could read the first item into the record.
Resolution 2023-0190, awarding a total sum not to exceed $10,000 to Birthing Beautiful Communities for the Birth Center Facility Project from the District 9 ARPA Community Grant Fund.
Thank you. As you come forward, please state your name for the record and any guests that you bring with you is at the podium.
Good afternoon. My name is Jasmine Long, and I'm here with my board chair, Michael Bowen.
Welcome.
Okay. Uh-oh. So at Birthing Beautiful Communities, our mission is to address and improve the systemic structures that lead to poor birth outcomes. We do this through culture, education, advocacy, support, and engagement. We know that infant mortality is a major crisis here in Northeast Ohio. In Cuyahoga County, we have infant mortality, maternal mortality rates that for African American communities are sometimes 3 to 7 times higher than our white counterparts. And so we're working to make a huge impact on that. And we do that by providing doula services to expectant moms. I'm going to go by fast because I only have a few minutes. Doulas are labor and delivery support coaches. And so
Breathe.
I speak in Columbus a lot, so I'm used to having to do these in like 5 minutes. We connect the dots of life. So we are addressing toxic stress and trauma, food insecurity and nutrition, postpartum care, child care, addressing breastfeeding, transportation, and a lack of pregnancy support. We connect the dots of life by providing a doula to each client that we serve in our organization. We are the only agency in Northeast Ohio that actually attends the labor and delivery of each of the women that we serve. And we also provide extensive postpartum care, including overnight care for families in need. A traditional doula may attend 1 or 2 appointments before your birth and your labor and delivery, and may provide some postpartum care if there is a monetary sum attached to it. We actually stay with women from anywhere from 12 weeks pregnant until the time their baby is 1 year old. We provide extensive wraparound services to teen moms, staying with them until they graduate high school. And so we know that pregnancy and infant loss is 80% social, 20% clinical, and so we work to address that 80% by providing housing, education support, food, transportation, anything that a mom or expectant family could need to actually find success in their pregnancy and their postpartum period. We provide our own in-house training that is about 8 days worth of training that really centers on the history of African Americans, culture, and also teaches labor and delivery techniques to the doulas that we're going to be hiring. So again, we have a mental health arm, which we require program participants to go through a 5-part mental and behavioral health program so that they're able to address panic, depression, anxiety, and fear, thus reducing their own toxic stress. We have childbirth and education, 3 classes a week. We have breastfeeding support groups as well as certified lactation counselors on staff who are able to assist moms who have breastfeeding challenges or who need support in that area. And of course, the labor and delivery support. So our mental health program is called Our Wellness Network. It is a 1-to-1 crisis counseling. People are going through grief recovery method, and it's actually something that we require 100% of our staff to go through as well so that we are able to deal with any traumas that we may have as well in doing this work. We also attend the labor and delivery of every African American woman who births at the Cuyahoga County Jail. We attend those births at Metro with them, and those are unshackled births where there is not a guard in the room and that there's only a doula and medical staff in that room so that that woman still gets to have a dignified birth. So this is our organization. We have 8 board of trustees, about 40 perinatal support doulas, 25 administrative team members. And our impact, we've served over, at this point, 2,000 mothers and families, trained over 150 doulas. We have a 91% full-term birth rate, an 86.2% breastfeeding initiation rate, and we have been able to sign contracts with 3 managed care providers to actually provide funding for our services to their clients. Where we are headed, we are working towards building a new birth center that will be located on East 65th and Chester that will be serving women from all across the region. This will be the first of its kind in the state of Ohio, a very catalytic project in a very catalytic neighborhood that is seeing a lot of investment right now. And we're very excited to bring something like this to our community, in a community where we know that in 2020 was ranked the worst place for Black women to live, work, and play, and with access to health care, that we want to expand options so that women have a safe alternative to birthing and they're not turning to unsafe birthing options. And so why the birth center? Patient-centered care, lower costs, fewer intervention, increased patient satisfaction, and improved access to care. Thank you for your time and support.
Thank you for that presentation. I will start the questioning, if you don't mind. Where are you currently located now?
Yes, our offices are currently located at the Grove Mansion, which is located on 31st and Superior.
And what is that Grove Man?
Yeah, GROH Mansion.
31st and Superior. Okay, timeline of New Birth Center?
Yes, so we are slated to open February of 2025. We actually just had our first design charrette today. We are in the process of, we've just received approval from the city that they are accepting our appraisal of the land. So we are going to be going through meeting with zoning next month, hopefully, and then the transference of the land to our property.
Okay, I did have another question, but I can't remember it at the moment. I'm going to open it up. Councilman Miller?
What is the $10,000 proposed here actually going to be used for?
Sure, that can be used actually. The cost of our land is $17,000, so we would want to utilize the $10,000 to be able to acquire the land, to be able to put the property on it.
And what's the total project cost for the birth center?
Yeah, so the total cost is $9.3 million. We have at this time raised a little over $4 million in commitments.
And where have the commitments come from? Is it public or private or some of both?
It's a mixture of both. We have received $3 million from private foundation, well, from foundations, and we received $1 million from the city of Cleveland.
And how close to raising all of the money would you have to get so that you would be comfortable to begin construction?
So we actually are moving forward. As soon as we've already done several things to the land that we have, we're moving forward because we did receive an allocation of new market tax credits from the Port Authority. So now that we've raised, we're about halfway to our goal. So we actually are ready to move forward as soon as we, do that. Our environmentalists came back actually good. So now we just kind of, it looks like if you ride by the land, it looks like there's like a couch or something. It was probably a basement that just is laid there. So we need to see what that cleanup process looks like, but we are actively moving forward.
What is your estimate as to how many children per year would be born at the birth center?
So we would anticipate in the first year between 50 and 75, and then we would grow year over year.
And how many would you have capacity to handle?
We would have capacity to do up to 100, but again, so right now, BBC, we serve about 720 clients. So that's what we served last year, in the last fiscal year. And so we know that we have a unique position because we can talk to our clients and educate them about the benefits of birthing in the birth center. So we imagine, and this is kind of a national trend where, like, if a counterpart of ours said that they were going to do 50 births in 1 year, they've done 100, because the interest really is there for women to have an alternative. Because in the state of Ohio, if you have a home birth, you have to pay out of pocket. To have a birth in the birthing center, you would actually be able to use your private insurance or Medicaid in order to get reimbursement for the services. So it actually opens up that possibility for women who may want to have a birth out of a hospital but can't afford the $3,000 to $6,000 to have a home birth.
And why would your capacity be limited to only 100? Even if you did just one a day, it would be 365.
So that's not kind of how birth works, in the sense of, like, we would really have to see who wants to birth at the birthing center. Not every woman has an acuity level to actually deliver at a birthing center. So to get a little technical, you have to be low risk to birth at a birthing center. So weight requirements, medical history, there's a lot of things that have to be taken into consideration for someone to be a candidate for a birthing center. But I will say 85% of women do have an acuity level to deliver at a birthing center. So I don't know if that was an answer to your question, but it's more complex than like necessarily thinking one baby a day.
Well, that might explain why you might only get 50 to 100 in a year, but it seems like a facility like this would have capacity to do more if the demand was there.
So if in the event that we notice, so we're only going to start with one midwife because we still have to do a lot of education about a birthing center because we don't have one in the region. And so one midwife would only be able to do that number of births. If we notice that the need is growing, then we will expand the number of midwives that we have. And so the way that our pro forma is set up, and I will be happy to actually share that with you guys and they can send it following. In the first year, we anticipate one midwife. In year 2, we anticipate to hire a second midwife because we'll be able to grow capacity after educating the community about what the birth center is going to do. And then, but if we do notice that a huge influx in the first year, then we can hire another midwife who could potentially support all of those births.
Okay, thank you.
Thank you, Mr. Miller. Is there a coordination with the other hospitals that currently have labor and delivery?
Yes, so in order to operate a birthing center in the state of Ohio and anywhere else, you have to have a transfer agreement. So as we are saying, we are, looking at women with low risk, anything could go wrong in a labor and delivery room. So we will have to have a transfer agreement with hospitals in order to transfer clients who, if something were to go wrong. We have had great communication with each of the 3 healthcare systems about the project, and they are all supportive because, again, it's not going to take away from them because we're not doing super high volume. And so we're not a competition to them. We're really a complementary services.
Councilwoman?
Are you going to be serving Summit County residents as well?
Yes.
Okay, anybody, right?
I imagine, just being candid, I think we will have women who might want to come from all over the state of Ohio because there is nothing like it anywhere else in the state. So we as BBC, we serve Cuyahoga and Summit County, so that's kind of our stomping grounds, but I do imagine that women would come from all over, potentially.
So this is an example of institutionalized, the medical institution coming in and crushing the midwives and the historical way babies were born, healthy. Medical came in, crushed midwives, crushed the doulas, and this is a way to come back with healthy natural births. And I'm really happy that this is in front of us. It's horrifying to me, actually, what the history of this is for all women, especially Black women. Doulas, are they even able to go into the hospitals now?
Yes, so we have really strengthened our relationships with all of the healthcare systems to get our BBC doulas back in. But even still, we have to have badges, we have certificates, we print out pictures of the doulas so that they know who our doulas are. So it probably is harder for people who are not BBC doulas, but we've worked really hard and we advocate for all doulas because we want women to be able to have that support system in the hospitals.
Okay, thank you for this work. It's exciting.
Thank you.
Through the chair, I don't really have any questions. I think my colleagues put forth some really interesting questions. I have been in support of your project since I first learned of it. And I have to say that, when, again, I keep saying this, or my colleagues say it, weekly about the county's resolution declaring racism as a public health crisis. And I think, we have to do more than just talk about it. So I'm happy to lend my support, my action, to be part of the solution to this problem. And so I ask for my colleagues' support.
Councilman Sweeney?
Thank you, Madam Chairwoman. Your excitement is you can't hide it. But I'd really, really, really like to hear from your president and chairman of your board, because I've never heard him publicly comment in a forum in this magnitude. So please tell us who you are and why is this an important project to move forward?
Yeah, through the chair, to Councilman Sweeney. Good seeing you again, my friend. So I've actually recently come on as board chair for Birth and Beautiful Communities, and to be fully transparent, I was doing some legal work and some advocacy work for them. And when this opportunity came to put kind of, quote unquote, my money where my mouth is, I thought it was a no-brainer. And so, we have a ambitious goal to raise this money moving forward, and I'm here to essentially stand with Jasmine and support her in my role as board chair. And yeah, that's it. So
through the chair, just watching your growth has been impressive, and now taking it to this level, I'm glad to call you my friend, and just keep up the good work.
pleasure. Thank you, Councilman.
Thank you, Madam Chairwoman.
So, Ms. Long, when you talk about, I want Well, racism is a public health crisis. Have you connected or been able to present this project and this program to our internal case advisory council?
Thank you for that. No, we have not had the opportunity. This is the first chance that we've actually had the opportunity to present this to the Cuyahoga County. Outside of, I think we met with economic development.
They do have a health committee, and they are working on external issues. So it would be very good to connect you guys to present, maybe possibly at one of their next forums. I know the next one is August 30th. I can't be presumptuous that they would just add you on that date. But if you would connect with Levine Ross, who is probably sitting behind the poll, she can give you the information, and we can try to advocate for that. If that's something that's on, we'll connect with you and see what's a good date so you can. That needs to be shared. Many of the individuals are out in the community, may or may not have heard it, but I think it's worthwhile to see if there is some relationship building that could occur there, and also, never know, possible funding. Anything else? Anyone else has to share? Anything else you guys would like to add?
Just lastly, if your husband was in this room, he is really big on the dads, right? And so that was one of the reasons that I was really happy to have a male board chair, and so that as a community we recognize that this is not just a women's issue. It is impacting Black women, but it's impacting our families as well. And so to have a male counterpart to really help uplift this work and to show the importance, I think we're just really trying to do something innovative and unique that really will make Cuyahoga County a more vibrant city.
Metro Health will be having, I believe on July 25th, come together meeting with community partners. I don't know if you've been invited to that in terms of talking about women's health. They want to have a kind of a women's health fair, like there's the men's health fair. So I'll definitely bring you guys up. Go ahead.
Sorry. Yeah, Madam Chairwoman, I want to add one point which is important, and actually seeing Councilman Sweeney reminded me of this. These dollars that we're getting from the city and the county are very important as we go to the state of Ohio and ask for capital dollars as the capital budget is coming upon us. So being able to show that local support is huge for us as we move towards that road next. And so, thank you for this, because this is bigger than just, a dollar amount. It's actually more of a symbol.
Have you had conversations with the administration?
The state administration or the county administration?
County
Oh, yes,
administration.
100%.
Okay.
Yes.
All right, very good. So definitely would like to see you at their health fair. That's a way to get the word out about any free marketing is always good. So we'll be doing some kind of business together real soon. Anything else further? Not seeing none, hearing none. Just in case you didn't know, ARPA applications have been agreed upon. They must go 3 readings. So you can watch us online and kind of know when this will come back. I don't know the date for you. It might be after we come back from break. Yeah.
Madam Chair,
Yes.
so the second reading will be July 18th, and the third reading will be August 1st.
So you'll make it before we go on break, if everything goes well with everyone. Very good. So nothing further. If I can have this moved and seconded.
So moved.
Second.
Okay, moved by Turner, seconded by Sweeney. All in favor for second reading, please say aye.
Aye.
Would you? And I believe anyone would like their name added. It's a good time to say now.
I'll have my name added.
You can
I
add
as
mine
well. Thank you.
Mine as well.
Okay, everyone that's up here. I know Meredith should already be on there. All right. Thank you guys for coming out.
Thank you.
Resolution 2023-0192, awarding a total sum not to exceed $23,000 to Share Homes, Inc. for the Safety Mental Health Tracker from the District 11 ARPA Community Grant Fund.
Good afternoon.
My name is Dr. Rhonda Turpin. I'm the Executive Director of Share Homes. The Safety app is an app that will track mental health participants, volunteer participants. The mission of it is to aid in keeping the community safe and informed. Share Homes is a life skills program, life skills training program. A lot of our funding comes from the Guardians, the Cavs, the Browns, the Woostein Center. We have concession stands where we do training with our youth. Currently, we have 116 youth registered, with 90% being males, 16 to 24, and the rest of percentage being females. We take youth that are transitioning from something, transitioning from foster care, transitioning from homelessness. We take our referrals through either the county workers or MyCom. My partner Royce at Formicos refers every week. We have concession stands at 5 at the Guardians, 6 at the Cavs, and we just signed a new Browns contract for Clubhouse, 3 stands. So just to tell you a little bit about Share Homes, what we do. In our life skills training program, we're the only one in Cuyahoga County. The biggest life skills program currently is in Franklin County called Crossroads, and we mirror Crossroads and talk closely with them. We hope to have more. They have 6 locations in Franklin County. We have 1 location. How I came about for the passion for this app is because I have a 23-year-old granddaughter who told me about Citizens, and I wasn't familiar with the Citizens app. So in studying the Citizens app, Citizens, what they do is track crime. You put in your zip code. He did a pilot program in New York. The pilot program here in Euclid will span 10 miles, which will be a smaller component with the safety app. And where he tracks and reports crime, we will track mental health. The problem, we all know the problem is young adults 18 to 25, 1 in 10, 1 in 10 have serious mental illness. And then in the United States, 26.3 million are on a caseload. 7.3 million do not take their meds, which is a lot of the problem, and likely 5 times more likely to be victims of crime. And I already talked about how this is a spinoff of the Citizens Act. The next one is, this is an actual client of ours. He's a runner. He does not take his meds and on several caseloads. Officers, his family and friends, and case manager will be able to chat with him, each other, and offer safety to all parties. Just picture, we have someone standing at the bus stop. We don't know that he's a mental health client, but in the app, as he has a cell phone on him, we'll be able to notify law enforcement. Ricky is in Euclid at this location or at Family Dollar. Notify his case management, and if any family is on the chat, notify his family he's here. So how that helps is that everybody is fully informed that this is just not a gentleman standing at the bus stop. It's some issues here. And it's national initiatives going on to stop violence against mental health patients right now today, including SAMHSA, National Association of Mental Health, NAMI. So we basically want to be a part of that. I'm not a techie, so I had to do a lot of studying with this app. I'm still learning. I learn every day and talking to the developers because I'm not a techie. But if you go to your phone and look up the Citizens app right now, download it and put your zip code in, you'll see where the gentleman, he could scan crime within a certain miles and tell you what's going on. If you put in this zip code, downtown Cleveland, he could tell you exactly what's going on. So we plan to use the same setup that he used to set up this app. How it works, let me get to the next slide. How it works is, here, eight agencies, community will download the free app. It's an app. It's also a paid version for $9.99, which will give you the chat option. If you download the app and use the free version, what that means, you could just see what's going on, but you have no interest in the chat. The use of radio airwaves and fiber and limiting to Euclid. We only have to partner with one police station, and also in South Euclid, because we're going the 10 miles, we're going south instead of, because north actually in Euclid would be the lake. So in the 10-mile radius, we're going south. The chat feature, if you have the paid feature, will allow you to give info and directives, with directives to law enforcement, directives to the gentleman. Sometimes many of the guys in my program have mental health issues. Sometimes it's just a matter of asking them, do you need a bus ticket? I mean, what's going on here? So to be able to actively and in real time communicate with them will be priceless. And also to let law enforcement know, okay, this is what this is. This is what this is. It will also help law enforcement and also help our community. The agent will basically be able to communicate with everybody and be that thread in this app. And the model that we're going to use is the Netflix revenue model. We are a 501c3. We've been a 501c3 since 2019, but this will allow us to pay more staff and also marketing and things like that. Why now? The reason why now is because it's many hundreds of incidents, and no one knows. No one knows it's a mental health client. A lot of times I've seen hundreds of incidents, and I'm not going to waste our time naming them up here today, but I've seen hundreds of incidents where later on, after the incident occurs, then we find out, oh my God, that was a mental health client. So everybody will know up front. Will we get every single case? No, but I think that with this app, we will be able to make some progress. And also violence against community, law enforcement, and also against clients. We're partnering, and we're excited about this project. We're excited about bringing it to our county, mainly Euclid. I'm a resident of Euclid, and my business is in Euclid. But also, I serve this population. I serve this population every day. So this is a matter that's close to my heart.
Does that complete your presentation?
Yes.
All right. In terms of individuals, when you say they don't take their meds, I know we can't make adults take their meds, but I don't know what the law is in terms of individuals that are 17 and younger. So it looks like Rick might fall in that,
Yes.
in that, where he doesn't really stay with anyone. He's kind of aged out. How does your organization work with him in order to try to keep reinforcing? I've heard the med issues.
Yes.
You know, the kids are not patient, number one.
Yes.
And meds, you have to work with them. They don't work standard for everybody. And so some of the side effects are so horrendous that they rather self-medicate other ways or just don't take them. So how do you handle that?
Well, I'll be honest with you, Councilwoman Conwell. It's not an easy task, and no two gentlemen are exactly the same. Some will listen. They will start to take their meds or take them to the clinic, call their case manager where they have free rides. They'll try some different medication. And then other times, like you said, some say, I'm not taking that medication. I don't like the side effects. It makes me sleepy. I'm not taking it. So we have a lot of different scenarios here. With this app, Councilwoman, we just want for the community to know, rather than walking up on a gentleman or running up on a gentleman and not knowing that they have severe mental health issues. I just think that the community should know, and it could not only save their lives, but also, some problems with law enforcement. To me, this has been a long time in the making as a solution, because it is no real practical solution on the table.
Okay, so I think that's where, I think this is great. Any app, especially with young kids, that's all they do is stay on the phone. But I'm trying to understand, so walk me through it.
Okay.
Rick has the phone and
Right.
he has the app.
Right. So he's, I'm going to give you a clear example. He's standing in Euclid on 185th in front of Family Dollar. He's standing there, and maybe a lady walks by, and he tells her, stop looking at me. Why are you looking at me? Okay, she gets on the phone. She calls the police and said, it's a guy standing in front of Family Dollar. I feel threatened. So before the police come, they're notified, okay, through the app, he's on this caseload, he's unarmed, this is his case manager, and so it's working as a team. And also, even if he doesn't answer the chat, they're working as a team. So and then a lot of times I have several guys that are runners. So a lot of times if he sees the police or anybody, he'll take off running. So that will let them know he's not running because he has a gun. He's a runner. He's diagnosed as a runner, and he runs. He runs everywhere. And I have maybe 10 guys out of 116 that are runners. They just take off running. So to me, I feel that will help law enforcement. I feel that it would help the community, and it will also help Rick and others, because a lot of times when they're running, it might be a cell phone, it might look like a gun. And he starts running, they say, oh, shoot. And so it's just, to me, just having a communication right there where they already know, okay, this is Rick, he's on caseload at Recovery Resources. Tanya is his case manager. She's on call, she's on the chat. He's a runner, he's unarmed. This could save a lot of problems that could happen. Yeah.
So that's probably why you guys are doing a pilot.
Yes.
Just for South Euclid to see
Yes.
how it works.
Yes.
Then, very good. Are there, I was just wondering, I don't know if I ever asked this question, so just wondering if you should know. Are individuals, young individuals, are they eligible for the service?
Absolutely.
Okay.
Absolutely. The services will be in connection to whatever caseload that they're on.
No, not that kind of service, just
Oh.
the service like the Army, the military.
No, not with severe mental health. Once they get that diagnosis, no.
Okay.
No. If it's something minor like PTSD, they might be able to get in, but no, not with severe mental health. That's automatically excluded.
So will this app allow communication with individuals? Can this app also connect with resources in the community? So you talked about being able to provide safety things, but just maybe Rick can find out if he needs a bus ticket.
Yes.
So I was just wondering
Yes.
if it was going to expand to that.
Yes, we're looking at expansion later on to things like that, to resources, to different social media outlets down the line. We're looking at that, but right now it's just confined to the chat where they could communicate with law enforcement and their case managers.
All right, and one final question for me. When will this app roll out?
Immediately. We do have funding. We do have some funding because, as I told you, we have the concession stand. So we are a unique organization, and that's a big part of our income monthly because they call it fundraising. I fundraise through Airmark and all that, but
You work hard, that's not,
Yeah,
that's
I
not
work-
fundraising, that's working hard.
I work very, 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 very hard.
I've worked one of those.
Okay, yes, 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 and especially with young males and young females. I work very, very, very hard, very hard. Yeah, they keep losing their pants, losing their IDs, yeah, I work very, very hard.
All right. I'm going to open it up to questions from the committee. Councilman Miller?
So am I correct that for this to work, that you have to get the providers, the clients and the local police departments to all buy into this and put this app on their phone and use it? Is that correct?
Yes, you would have to download the app on your phone because it doesn't work without downloading the app.
And have you talked to the necessary participants and have their cooperation assured?
I haven't talked to Euclid Police Department, but I have talked to Cleveland Commission, but this is not in the city of Cleveland. And everybody, it's a need for it. I haven't met yet with the Euclid Police Department.
Okay, thank you.
Councilwoman Simon, would you like to share anything?
Yeah, good question, Councilman Miller. I did speak, by the way, to both departments, and
Yes.
we're going to be having a meeting, obviously, before the final reading and passage to make sure that there's buy-in. And from my initial conversations, they would like to participate with that. And in terms of why this is important from a criminal justice standpoint, we see how much violence has been imparted against mentally ill people that the police didn't know, and they shoot first and ask questions later oftentimes. So I can name a few myself. This would really help eliminate those tragic and unnecessary shootings. And when we talk about racism as a public health crisis, this is another part of that when we look at the criminal justice system. And this is just one piece to help prevent that violence, systemic violence.
Yeah.
Thank you.
Madam Chair, I would like the record to reflect that Ms. Stevens is in attendance.
All right, welcome, Councilman. All right. Anything else you'd like to share, Dr. Turpin?
No, I'm really excited about the project. I just want to add that I would like to change for the future how mental health patients that are around in the streets, how they're dealt with, the response to them. And I'm really excited about the project. It's a passion with me.
Thank you for sharing, and thank you for coming up with this app. Anything that helps our individuals remain a lot safer, that would be a good thing. And so outside, when we talk about an app, I know you talked about police and certain individuals downloading the app. Would it be recommended that just average citizens should download that?
That's a good question. They can, if they're interested. It's free. They can download if they want to see what's going on in Euclid, what's going on in that area. It's free. So they may just want to see exactly what's going on.
Okay, thank you. I'll make a motion to move R2023-0192 to the full council for second reading. Is there a second?
Second.
Moved by Conwell, seconded by Turner. All in favor, please say aye.
Aye.
Madam Clerk, if I could add my name to that.
And Turner as well.
And Stevens as well.
Madam Chair.
Yes, Councilman Miller.
I think this is pretty speculative and innovative, but it's an area where we certainly need new ideas and to try new things, and so I would also like my name added. Thank you.
All right, thank you. I believe all of us again? Because I'm sure Councilwoman Simons is already on it. Thank you, Dr. Turpin, for coming out. You can just watch us online, and our office will be getting back to you to let you know when you could probably come back and give us an update, where you are in the program and all that. Because the app is designed already, correct?
No, it's in the
Not?
process.
Okay. So do you have a timeline on that?
Within 90 days.
Okay. So that'll be a few months, but
Yes.
we'll invite you back. Okay, you're welcome.
Thank you. Thank you for inviting me.
Madam Clerk, if you could read the last item into the record, please.
Resolution 2023-0201, authorizing an amendment to an agreement with the Metro Health System for comprehensive medical services for families involved with the Division of Children and Family Services for the period January 1st, 2023 through December 31st, 2023, for additional funds in the amount not to exceed $1,038,459.52.
All right, welcome.
Afternoon. Good afternoon. Marcos Cortez with Health and Human Services on behalf of Children and Family Services. With approximately 2,000 children and youth in care, DCFS determined there is a need for full access to trauma-informed medical services that could appropriately address the significant challenges that children and youth are faced with when being removed from their home or placement. In order to pursue the safety, health, and well-being of children in custody, DCFS offers comprehensive medical services, including screening and assessment of healthcare needs of children and youth, comprehensive post-placement physicals, and alcohol and drug testing for caregivers, youth, and other adults in the home. This committee reviewed this contract earlier this year in March. We are bringing this contract forward now to add funds to ensure that we have enough funds to cover the rest of the year. As you know, we've had some issues with payments being timely. So when this contract was finally approved in March, we had to pay invoices from 2022 and then from the first part of 2023. So we are all caught up now, but because we had to pay 2022 funds or invoices out of 2023, we do not have enough funds to make it to the end of the year. So that is why we're adding the additional funds. There are no changes in the scope of services, just adding the funds. We have Dr. Lauren Gopel here from Metro, who could answer specific questions related to the program, and also Karen Storman from Children and Family Services, who could also answer some specific program-related questions.
What was the doctor's name, Lauren?
Lauren Gopel. I hope I'm pronouncing it right.
Okay, I have a few questions. I guess they're contractual questions. So does this include potential nursing contract specifically for the children that are in the DCFS building?
So this fund does not include that. I know that there are discussions with Metro to add that piece. If that piece is agreed upon, there would probably be additional funds added to the contract as well.
Okay. And correct me if I'm wrong, this is an annual contract?
Yeah, well, I believe it's annually, but I believe this current contract is for 2 years. So we'll just add funds at the end of 2023 for the second year.
Okay. So, and why again is it an annual contract?
So we do contracts every year. So like it's a 2-year contract, but in 2024 we'll add the funds when the budget is open.
Okay, so when will the new RFP?
Probably, if it's a 2-year contract, it would probably come out at the end or middle of 2024.
Okay, in the past, there have been other bidders on this contract. I think just recently, we've only had Metro. So when the process comes up for the RFP again, will that be put out there, put forth to all the hospitals?
Yeah, so generally when we do an RFP, we have a plan holders list, and that is a list of at least 10 providers who could potentially provide these services. So the RFP goes out to those on the plan holders list, but additionally in our strategic sourcing portal through Infor, anyone who has signed up for the commodity code that this is related to would also get a notice that this RFP is out there.
You could please send the list to Levine.
Sure.
So we don't have 10 hospitals, so that must be, is that some clinics as well? that
Probably,
are-
I'd have to look at the list.
And the total amount of the contract, okay, so you explained that, because I was wondering if it was an increase, but due to the lack of timely payments, you've had to pay them out of the budget, so now we need to give more for the rest of the year, correct? Okay. And it's roughly the 1 million, a little over the 1 million?
1,038,459, I believe.
Okay, and I forget, so Metro invoices us?
Yes,
On a
Metro
monthly-
invoices us, I believe, monthly,
Okay,
and then we, like I said, I believe we're caught up now, so we don't want to get any further behind. So that's why we need to add the
okay, so I
funding.
just want to be clear. I know these are for the, all of the children that are in our care, whether they're in foster placement
I'd
or
have to
anything?
look to Karen
Yeah.
Storman on that, for that question.
Get a lot of questions for this committee, for this contract. I don't know why. It's like I can't remember all the details. Welcome. State your name for the record.
Hi, good afternoon. Karen Storman, Children and Family Services. This contract does cover all children who are in DCFS custody. Ohio Administrative Code requires that children be examined physically before they are placed in an out-of-home care setting. And so it covers the triage process as well as a post-placement physical, any behavioral or physical specialty referrals for those children. And part of this contract, actually a large portion of this contract also covers toxicology services for caregivers of the children who may or may not be in care. So as a preventative measure, many of the case plans that the agency administers require some toxicology services to ensure sobriety and the safe care of those children, to either prevent removal or to work on reunification. So the toxicology component of this contract is also a large percentage of the resources allocated.
All right. Dental, eye, is it covered? Dental and eye service? Okay. I know I always ask that. I'm going to open up to my colleagues for any questions. Councilman Miller.
So, since payments were delayed, was there money from 2022 that was decertified at the end of the year because it wasn't used that essentially offsets the money that's being added here?
So any contract that had a balance at the end of 2022, which this contract probably did, was decertified per the requirements. So I don't know, I'd have to look back to see how much was actually decertified, but it should be almost even split.
So, could you check that out and follow up and let me know? Thank you.
Seeing none, hearing none. Anything else you'd like to add, Karen or Mr. Cortez?
I have nothing further to add.
All right. Did not have a chance to look at the dates. Do you need the second reading suspension?
I mean, as long as it gets approved by August 1st, however, I don't know if we have any outstanding invoices that have come in. So the longer it's delayed, we would have to hold any invoices that are there.
Yeah, that was going to be, so let me know if all contracts are up to date.
Excuse me?
Let me know if all payments are up to date for Metro. I know they fall behind, but I think we've been doing pretty good since the meeting.
Yes.
Correct? Okay. So can I have a motion to move R2023-0201 to the full council under second reading suspension?
So moved.
Second?
Moved by Sweeney, seconded by Turner. All in favor, please say aye.
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 Thank you. Thank you very much. Any miscellaneous business from anyone? Seeing none. none. All right, this meeting is adjourned.